Maddie.
Hello.
It's good to meet you. Thanks for coming in today.
Thank you for having me.
So before we get started, I just wanted to let you know a couple things about privacy and confidentiality. Everything that we talk about in here is confidential, and I won't, talk about, if I do talk about this case with any colleagues or anything, we won't use identifying information. The only reason I would ever need to break confidentiality is to report if there was previously unreported child abuse or elder abuse or abuse of a vulnerable individual. But in that case, I would work to make that report with you to the level that was possible. So does that sound okay to you?
Sounds great.
Okay, sounds good. So I just want to tell you some of the basics of the model that I'm working from. So I use something called solution-focused brief therapy. So the word brief is kind of relative. If we feel like you want to keep working on your issue that has brought you in today, then we will keep working on it as much as we need to. But it's one of the briefer therapy models. We don't try to keep patients in here for years on end if they don't need it. And we really believe that you have the strengths already within you and in your past to make you successful in the future, because you've done a lot just to be here right now where you're at. So, yeah. So I did get your intake questionnaire that you filled out before you came in, but I want to start by just kind of getting to know you a little bit first. So, have you ever been to therapy before?
Only brief little stints, I would say.
Okay. Yeah.
So, yeah, probably more short-term.
Okay,
that, yeah.
so like kind of similar to what maybe this is as well.
Yeah.
Yeah. Okay, gotcha. Was it through like EAP usually?
Yeah,
or
work
like
wellness
that?
EAP.
Okay, gotcha. And did you enjoy the experience that you had there, or?
Yeah, it was okay enough. Yeah.
It was okay.
Yeah, it wasn't super great, but
okay, yeah.
Yeah, but that was probably because I didn't pursue it further.
Maybe, yeah.
We'll see.
What were some of the aspects that you did like about it?
I liked the therapist. She was awesome.
Okay.
She was very open, and we had good rapport. But, yeah.
That's good, yeah. That's awesome. And then just for me to know, what were some of the things that you maybe didn't like as much about it?
I don't know. I felt like the one was out of town a lot, and the other, there was one that filled in, and
that's
that
weird.
Was, yeah.
Yeah,
Not
I
as
don't
great
even
of a
know that I've
listener.
really heard about that happening, but maybe with EAP sometimes they have to like swap
Yeah.
like that. Okay,
Something like that. Yeah.
Yeah, that makes sense. Why that would kind of like interrupt the continuity and like, I don't know. Hopefully you didn't feel like you had to tell your story all over again, but
No, just a little bit.
Yeah, here and there.
That's all right.
Okay. So tell me a little bit about what you do for work.
So I'm actually a nurse.
Oh, wow.
Yeah, I work with hematology and bone marrow transplant patients.
Oh, wow. Okay.
So, yeah.
It sounds like
What I
really
do.
hard but fulfilling work.
And that it is, yes. Hard, but yeah, it does help to feel like you make a difference.
Yeah,
That's
absolutely.
cheesy. Yeah, but
yeah. And did you grow up in Salt Lake? Or?
yes, born and raised in Salt Lake, and yeah,
Nice.
I've been here, so.
Yeah. So you must like it. You've stuck around. a
Yeah,
little bit.
exactly.
Sounds
I like
good.
it enough, yeah, and it's nice that you can get in all sorts of different environments.
Yeah.
The short drive.
Yeah. You can drive a few minutes and get up to the mountains and whatnot.
Yeah, exactly. From southern Utah, wherever.
Yeah. Sounds good.
Yeah.
All right. So can you tell me a little bit about what brought you in to see me today?
Okay, so I've been struggling a lot more going to just like the grocery store, just like picking out like food and stuff and feeling like kind of paranoid and self-conscious and socially anxious. So yeah, just kind of every time I go to the store anymore, I get really, really nervous and like have sweaty palms and just start like sweating and panicking kind of, and definitely like feel my heart just kind of going crazy, and then I feel like I'm running through the store just to get it, done and not trying to avoid people. So, yeah, that's kind of the overall,
Yeah. That doesn't sound fun.
No, especially when it's something you need to do to go and...
Yeah, it's not exactly something you can really avoid doing. So, yeah. Gotcha. Yeah. So at the end of our work together, we don't really know exactly like how many sessions, but we'll kind of decide that. But what is like, I guess, one of the big changes that you're hoping to see by the end of our work together?
I'm hoping that I can go, like, grocery shopping just without reaching that level of panickiness.
Okay.
That I can kind of better cope with that. And hopefully, eventually, I won't kind of have that at all, but at least have some tools moving forward.
Yeah. Okay, so maybe just get some tools and strategies to help you not feel the same level of panic that you're feeling now when you go to the grocery store. Gotcha. So if I were to ask you on a scale of 1 to 10, where 1 is like super calm, like chilling at home, and 10 is like the most anxious you've ever been, how anxious do you usually feel when you are at the grocery store?
Usually I'm around an 8.
Okay, wow.
Yeah, so I can get really nervous as soon as I go in the doors. Yeah, or in the parking lot.
I can see that would make it really hard. An 8 wouldn't be easy, definitely, at the grocery store. Yeah, okay. And so when you are, at the end of our work together, or even just in your own progression over the next few weeks, when you do feel less anxious at the grocery store, what is that going to look like to you?
To me, it would look like at least not a full-on panic response going in. Just being able to feel like I can breathe and get my groceries without being so nervous about it.
Okay, yeah. So you mentioned you'd be doing more of breathing. That's kind of a big thing.
Yeah,
okay.
Definitely more breathing and less just overall kind of paranoid that people are like watching or whatever. Judging. Yeah.
Okay. Yeah, that makes sense. If you were feeling less paranoid at the grocery store, what would you be feeling instead?
I would like to be able to just kind of like, I don't know, continue on my day.
So it sounds like in most situations, other than the grocery store, you don't feel like paranoid, right?
No, yeah.
Okay.
It's like, I think it, has more to do with that it's a food setting kind of a thing where like, I don't know, so just that whole judgment of like, oh, the big girl's going to get food kind of a thing. So,
So there's some thoughts that might be underlying that particular situation that makes it different from just everyday life, other situations.
Yeah.
Okay.
Because I feel like I usually handle myself pretty well otherwise.
Okay, yeah.
I'm able at least to put a mask on and do what I need to do, so,
yeah. So you said if you're not feeling as paranoid, you'd kind of just carry on the same way that you do in like the other realms of your life.
Yes. Exactly. Just be able to move through it without panicking. It's not like I feel like I'm saying something. But...
No, you're fine. You can say things over and over. It's fine. So you're talking about feeling a little bit less paranoid. So I want to think about like maybe one of those other situations in your life, like that's not the grocery store, where you said you do feel like pretty, like well, I don't know. I don't know. You didn't use the words in control. You kind of used the words like you felt like you could just be yourself. You felt like you could carry on and get what you needed to do done.
Yeah.
So maybe like in your profession, so as a nurse, what kinds of things, or I guess how do you feel that's different than how you feel when you're at the grocery store?
Um, as a nurse, I feel like maybe I'm just more in control of the situation. I'm more in the groove too, because it's just my work and it's what I do. It's my routine.
Yeah, yeah.
And generally, I'm an outpatient nurse, and so I'm only with patients for maybe 40 minutes at the most. So it's not as much. I don't know,
but some people would feel a lot of social anxiety in that situation, right? 40 minutes. So, but it sounds like you don't.
No, I don't know. I don't know if it's something to do with more their vulnerability, and so I'm not feeling as vulnerable because I feel like they're kind of that person in that situation.
Yeah, that makes sense.
Yeah.
But you kind of mentioned feeling more in control in that setting in the workplace, and
like I can kind of move around and choose like what I want to be doing and how and stuff. But
yeah. Do you think there's anything else like about you being a nurse that makes you feel more in control in that situation? Like,
I don't know if I hide behind the like kind of power discrepancy of being a medical professional in that setting.
Yeah, and I wouldn't say there's, well, I mean, in my opinion, anything wrong with that. In that setting, you want to feel like you're in control, right? Like, I wouldn't want a nurse that didn't feel like she was in control. So, but that's interesting because I kind of, I was wondering if that had something to do with it, or even like all the rigorous training and like, so there's a lot of preparation that goes into that.
Yeah.
I wonder if that helps you feel a little bit more in control, just like the amount of
and I can always go back to I know my training and what I need to do, and like if this happens I do that, if this starts happening I do that, and just it's so ingrained that I feel like I have a track to fall back on probably.
Okay. So we want to get to the point where going to the grocery store feels at least a little bit more like maybe not exactly what going to work feels like, but at least a little bit more in control like you do at work. So if you were to go to the grocery store and not feel so, sorry, can I ask, do you go with like friends or family members ever, or do you usually go shopping alone?
Usually alone.
Okay, gotcha. So if you were to go grocery shopping and you're not feeling anxious anymore, next time you go, what would the other people around you notice that would be different about you? Like, let's say maybe the same clerk is working last week and she's working this week, and this week you're going in, you're not anxious. Would she notice anything different about you?
Probably that I'm not rushing as much going through the store, like, and that I wouldn't like, kind of probably like a lap around. Like, because like kind of if you see somebody on the aisle like somewhere where you're going, and so you like go the next aisle over, and kind of wait until they're done and come back up, kind of a thing. So probably just be overall faster.
Okay, so you would be faster even though you wouldn't look like you're rushing, because you would be able to not have to avoid certain like spots in the store and things like that. Okay. Yeah, that makes sense.
I'm sure I would just posture a little bit differently. I probably make myself smaller and try to like just kind of but
what you mean, like
more confident in my
next
space,
week if you
maybe?
gotcha. So like carrying yourself differently sounds like
just better posture for more body confidence, I guess.
Gotcha. Okay. And how would you feel differently, if you go in next week and you go on your grocery shopping trip and you're not feeling anxious? What would that feel like?
It would feel empowering for me, just because it's been a thing that's always been a trigger of sorts. It'd be a relief too, just to feel like I can run to the store and not have it be something that makes me nervous.
Mm-hmm.
And so, yeah.
So the word relief, that sounds like that kind of captures, like, what that would feel like.
Yes, yeah.
Yeah.
Mm-hmm.
So, like, and when you say that, I just, like, picture breathing more, like, breathing deeper.
Yeah, that would be good.
Yeah. Always good.
Uh-huh.
Good to breathe. So in the last, like, few months, has there been any... So you mentioned, like, you're at, like, an 8 now when you go to the grocery store, your anxiety level. In the last few months, have there been any grocery shopping trips where it's been anything less than an 8? Maybe even, like, at least a 7 or a 6?
Yeah, I think kind of I can be, if I'm having, like, a good day and otherwise doing okay, I can be down to, like, maybe a 6.
Okay.
Yeah.
Yeah, wow.
So if I'm, feeling really good.
Yeah, so, like, a good day, like, so it sounds like things before that grocery shopping trip, like, went well for you, probably.
Exactly, I was feeling really secure and confident and, like, kind of, like, I've accomplished things that day and stuff.
Gotcha.
I don't know.
Okay, yeah. And it might be hard to, like, pin down a particular day because we go shopping so often.
Yeah.
But, when you say, like, accomplished things before that, what kinds of things might you have accomplished before that?
I always just feel better when I, like, am, crossing things off my to-do list, Just dropping off something at the post office or stuff like that.
Gotcha.
Little errands.
Yeah, okay, gotcha. So you got, like, a bunch of errands done that you needed to do before you went on your grocery trip, and then you showed up and you felt more empowered.
Yeah.
Okay, yeah. And were there, I wonder if, like, when you are, like, checking things off your list and getting stuff done in the morning or whenever before your grocery trip, you are, like, saying anything to yourself. Or, I mean, a lot of times we don't consciously say things to ourselves, but if you, like, subconsciously might have had, like, what were you thinking probably at that time?
Not that. I don't know. I guess I wasn't, like, dreading it as much, maybe. And so maybe just not having that dread as well kind of coming into it.
Okay, yeah.
Helps just...
But do you think that's, like, because, well, I guess if it's just, like, at the end of a long list of errands.
Yeah.
Do you feel like that kind of changes how you feel about it, or? And I could be wrong.
Yeah. I feel like it just changes depending on how I'm mentally feeling overall that day more so.
Okay, that makes sense.
Yeah. Because if I've had a long day where I've, like, gotten a bunch of things done, but it was a crazy day, I feel like I am that much more likely to feel paranoid about it and more anxious. Whereas if I've gotten a lot of things done but had a nice morning and was just more relaxed and like feeling more mentally like just well and happy, then I would feel good after doing a bunch of things and going to the grocery.
Okay, yeah. So it sounds like you have, like, had those days where you do notice you feel less anxious, but it tends to be, like, more associated with, like, how your mood was, like, earlier in the day, and you were feeling more relaxed beforehand, and also you felt accomplished because you got some stuff done. So, but it almost sounds like it's a little bit at this point, like, random, almost, like, not quite sure, like, why I felt better that day, but it did go better.
Yes.
Yeah, gotcha.
Yeah,
okay.
Exactly.
Yeah, so, and I also just have, like, kind of a question I'm curious about as well. So, like, I don't usually go grocery shopping with anybody else, but, like, when you have gone with, like, someone that you're close to, does that ever help?
Yes. I think just, like, having another person that I can kind of, like, be interacting with and talking with, so I don't feel like I have to be as aware of other people, and then in that same sense, maybe they're not as aware of me, even though that's probably not rationally, like, there, but...
I mean, it very well could be. It's, like, funny how we, most people are, like, not aware of anything that's going on around them anyway.
Yeah.
But I mean, it's so easy to, like,
And I so rationally know that everybody's doing their own thing. And
right.
people don't care, really, but
But
yeah,
that's,
just that
you can't just like tell
anxiety.
your side. Yeah,
Exactly.
that makes sense. Yeah, totally.
So,
Yeah. But so like when you have on like some occasions gone grocery shopping with someone like close who you feel very comfortable with, it has helped maybe like as a distraction a little bit.
Exactly. A distraction and probably mostly distraction. And then they're probably getting their own things, so then I can kind of follow and grab things as I need.
Gotcha.
So and it doesn't feel as much like it's that me more directly and only. Yeah.
So that sounds like that might be like another situation where you have that and some exception to like the panic that you feel in the grocery store.
Yeah.
Okay. Yeah. So I'm wondering if we could come up with some items for you to maybe just test out before we meet again next week.
Yeah, that'd be great.
Yeah, but for starters, I do want to just ask, have there been any strategies you've tried already for dealing with your grocery store anxiety?
Not really. It's usually just kind of grit your teeth and do it.
Push through it.
Yeah.
Okay.
So.
Gotcha.
So I'm open to any suggestions.
Okay, sounds good. So one thing I want to start by suggesting is just because like when we were talking about like times in the past when you didn't go with like somebody else but you went alone but you did feel less anxious, like you felt a 6 instead of an 8. You were kind of like, yeah, it just happened because I was in a better mood already that day, got a lot accomplished, but didn't really seem like we know why else that happens. So I want you to try to pay attention the next time, so the next day that you wake up and you're kind of feeling lighter already and kind of feeling calmer, and maybe it's your day off and you're about to go to the grocery store, just try to like pay attention and maybe even write down just a couple notes about like what thoughts are going through your head at those times, and then maybe if you can like figure out what might be contributing to that. I know that's kind of hard sometimes, but usually maybe if we like do a little digging, at least maybe you could identify like something that might be associated with that. So that's like kind of a first goal, just to like observe what's going on. Does that sound reasonable to you?
Yeah.
Okay.
Yeah.
Sounds good.
I'll definitely try to
Okay.
see about that.
Cool. Yeah. And I think already like you have, you know, this whole like other part of your life where it seems like you really are acting in like what that exception, that whole like you feel in control and you're like breathing kind of easy and you're you know competent nurse and you're a good friend, it sounds like, and so there's all these other aspects of your life where you know you have that less anxiety. So I think that you're on the right path towards figuring out how we can just help that generalize to that situation as well, but it'll take some work. We'll just have to figure out what exactly it is that can help with that situation. So, and then another thing I want you to maybe try out and so I think we want to prioritize just like kind of watching what it feels like the next time you go to the grocery store, and if it's better, watching like what might be making that better, just so we can kind of figure it out. But another thing I want you to try to maybe practice in your mind is, so you described to me very vividly what it would look like if you weren't feeling anxious walking through the grocery store. You said you'd have, you know, maybe a bit better posture, just kind of taking up a little bit more space. You would be less rushed, but still faster at getting what you need to get done. And you would just feel inside relief and you would be able to breathe. So the inner ones are a little bit harder to change, but I'm wondering if you could just practice maybe the next time you go to the grocery store, just walking with a little bit of what you might call a better posture, and then not rushing as much. Or when you see that aisle at the grocery store where someone is on it, maybe if there's just one person, just kind of challenge yourself to walk down it. So maybe just try those two things next time you go to the grocery store, and then come back and we'll just talk about how that went.
It does sound like great jumping off point.
Okay, sounds good. Cool.
Yeah.
Awesome. And then just to ask you, just to wrap up the session, so you mentioned at the beginning that right now you kind of feel at an 8 in anxiety when you go to the grocery store.
Mm-hmm.
When you try out just like those 2 strategies, where do you think that might leave you at in terms of anxiety level? If it did help.
If it did help, I wonder if it would go just hopefully down to at least a 6, at least like a good day kind of a thing.
Maybe even just a 7, because like it's not a huge change, but like just even anything.
Yeah, any difference would be better than that panicky feeling.
Yeah,
so definitely.
And that's the thing, like especially with anxiety, is like it needs to kind of has to build up again before it gets that bad. So if you can even take it down just a little bit, it'll have to build up again just to be. So any little thing you can do to take it down just a little bit.
Yeah.
Even though sometimes it doesn't feel like it helps a lot, and that can be really hard.
Yeah. But I think the posture and stuff, I think it'll kind of help me fake it a little bit. And also maybe I'll be a little bit more open and focused on my breathing just because my posture is
open up a little bit. That's a good point. Yeah, I didn't even think about that, but that does make sense. Yeah. The breath is like so affected by how much we're slouching and everything like that. Yeah. And then just to ask you to scale a couple more things, how confident do you feel that you can decrease your anxiety level from an 8 to say a 6? That's even possible at any point.
I think it'll be possible with a lot of work.
A lot of work.
Yeah.
Okay. Yeah. And then on a scale of 1 to 10, how much motivation would you say that you have to put in that work?
I have a lot of, so far I have a 10, a lot of motivation.
All right, that's awesome.
Yeah, I'm ready to not feel that way.
Yeah, well, I really commend you on that because so many people don't have that much motivation to make changes in their lives, so that's kind of a big deal already.
Yeah.
Cool.
It's 1 year.
Sweet. All right, well, it was really good to meet with you,
All right.
and cool, we'll see you next week.
Awesome, thank you so much, Pamela.